Well, Happy New Year. Welcome to January and today's episode. This year we've decided we're going to rename these episodes, and we've decided on the name of The Pulse. One of the things that we're very interested in, you as employees have spoken to us through the engagement process of we need to do a better job of communicating with you. This is one of the mediums we want to do that. We want you to have a pulse on what's going on in your organization. We care about you being engaged and active in the organization, and so we've rebranded, renamed this, and we hope it continues to bring value to you as we go forward. So we're excited to start off the new year with a new look, and joining me to start off the year is Jody Smotherman. In the past, you've introduced him as the Graduate Medical Education Director, and he continues to hold that. But as we go forward into this next phase of our organization, one of the areas that we feel we have an opportunity is to expand our presence and efforts in community engagement. And so I've asked Jody to pick up that gauntlet, so to speak, and raise the bar in what we're doing in community engagement, in addition to graduate medical education. And so Jody brings a unique passion that I've had the opportunity to witness over the past year or so. And so, Jody, welcome. Thanks for joining us today. And why don't you remind our viewers of your background, pharmacist by background, and
Sure. Born and raised in this area. Went to pharmacy school at UAMS. After graduating pharmacy school, my wife and I moved to Memphis, Tennessee for a few years. We decided to start a family. We moved back to Batesville, our home area. Started at White River Health System as a night shift pharmacist, and then became pharmacy assistant director, then director, and then moved into other areas like quality in the hospitals department, and most recently working with graduate medical education or the residency program, the internal medicine residency program. So looking forward to this opportunity.
Yeah. So as we speak, we're actively involved in recruiting for the third year of our graduate medical education program. Will bring us a full complement next summer. That's pretty great. Exciting. Congratulations on the success of you and Dr. Kasani. Have done a great job, and we're proud of that. So
thank you.
So community education or community engagement, kind of a unique area, and a lot of people have probably asking the question, why Jody? Why this role? What's so important? But you really bring a unique passion. Tell us what excites you about the opportunity.
Being born and raised here, obviously, love this area, love the community. Being involved in community engagement seems like the perfect opportunity to marry a desire for community service and health and wellness. So when people hear community engagement, they need to begin to think of the 2 points on the horizon that we'll try to merge are promoting health and wellness in our service area, as well as providing community service. And one of the ways that we'll do that is much like how we did the WRMC 5K this year. We raised a lot of money, promoted health and wellness, but every bit of that money was given to local school food pantries. So expect more events like that will marry a promotion of health and wellness, community education about health and wellness, along with community service and giving back to the community.
Yeah, great. Obviously, a lot of people may question that motive and the execution of that, but boy, when you think about one of the things that we want to do is really help our community understand we're here to serve.
Correct.
The way healthcare has been in the past, you think through the way we operated 20 years ago, it was really that reactive mode, right? Where we wanted people to come to us in crisis. Well, health and wellness, you got to kind of be out there, and you think about the infrastructure, the clinics that we have and everything in so many communities that we're a part of. This is a great extension of ourselves and showing our communities we want to serve. We want to be here proactively, and if, God forbid, something happens reactively, you need us, we're here as well. But we're excited about it. Great ideas that you've had so far. We look forward to seeing what it brings down the road, and we'll look forward to visiting more with you down the road. Thanks for joining us. In the last couple of weeks, we had the opportunity to celebrate the 2018 Employee of the Year. We had a great banquet and got to recognize all 12 employees that were nominated. And again, congratulations to each and every one of you. Great aspiration. It's a great service that you provide to our organization. A great way for us to recognize how valuable you are to us. At the end of the day with voting, Laverne Treadway, Environmental Services, has been with us for over 6 years. and was nominated. And Laverne, we're proud of you. We're very happy to have you in our organization and the service you provide. Congratulations to you. We look forward to you contributing in a positive way throughout the organization. So congratulations to you. For the Employees of the Month this month, for Stone County Medical Center, Debbie DeVito was nominated. Debbie works in our respiratory department at Stone County Medical Center. She's been with us for over 15 years and was selected for her work ethic and exceptional customer service skills. Debbie, thank you so much. Those skills are invaluable. Those are what we want to show every patient that walks in and honors us with their service. Thank you for your dedication. Congratulations on being nominated. At White River Medical Center, Angie Smart, out of our HIM department, was recognized. She's been with us for 14 years and recognized for being involved. Angie, thank you so much. Being involved is such a critical component for all of us, not just that day-to-day doing our job, but really looking for other ways that we can find additional ways to invest back into the organization that means so much as employees and obviously to those we serve. So congratulations to you as well. Thank you for your great work for our organization. January, a couple of events, Cervical Cancer Screening Month. As we've talked a lot about proactive healthcare, this is one of the ways that we want to encourage our own employees and certainly our communities to get screened. When you can find issues like cancer early, and there's a much greater chance of treating them and successful completion of that versus finding it late and the complications that are there. And so we certainly want to encourage everyone to participate in that. It's also National Blood Donor Month. We'll be having another blood drive here at White River Medical Center in the Conference Center on January 10th. So we would encourage you to come out and participate in that and help us keep the need for blood for those needing it going. It's also Thyroid Awareness Month in January, and certainly thyroid health is important in a proactive manner as well, and so want to recognize that. As we start January, start this new year, obviously it's a new opportunity, it's a new season in our organization. We've talked about some changes. We've had some guests that we've introduced to you with new roles in the organization and the org chart. And so as we go into the new year, really a new focus, and really could simplify it in three ways. First of all, we want to continue to focus on our employees. You're so important to us. We want you to see that we're serious about engaging with you going forward. We'll be doing our second engagement survey in the year 2019, so we look forward to that. Continue to invest in that. We can't do anything without all of you, and we thank you all for that. Second of all is simply that we make sure in every business line that we're doing all the business skills that we need to be doing and that we're doing them well. That we're billing appropriately, we're collecting, we're doing all the things that we need to be successful as a business. That needs to be a huge focus for us in 2019. And so as we set goals and look at expectations, that's where a lot of focus will be to make sure we're doing everything we can to serve our mission. We need to keep our doors open, obviously, and we need to do that by being a good business steward. And then lastly is really the idea of as we learn to do your jobs well, once you've accomplished that, it's that idea of being involved, looking for additional ways, creative ideas that you have for us to do things better, cleaner, better service, etc. That we're really looking for everyone as we go through the employee engagement process, identify business. That's the next evolution. And so just kind of a simplified way for us to look at what we want to do over the next year, and we'll put some tangible feet around those as we go forward. And any ideas you have along those are certainly welcome. Some things going on in our organization. Stone County Medical Center Cardiac Rehab has moved to a brand new location. We're excited. They've had a lot of growth. Congratulations, Kevin and your team for doing some great work there, identifying a need and being able to grow that. We're excited about that. Another growth opportunity we're having in the Fairfield Bay Area. We're opening a clinic in January. A great opportunity, a market that we've not historically been in, that we're looking forward to serving. We'll have a nurse practitioner, Ashley Bagwell, who will be there serving in that capacity, and we also anticipate having specialists go to that clinic. Orthopedic right out of the gate, and we're looking forward to serving that community and adding to our market as well. Along the lines of orthopedic, we want to congratulate our orthopedic surgeons on performing the first robotic-assisted hip replacement surgery. Very exciting. This is a coupling of specific training that our surgeons have and the coupling of our robotic surgery. We're excited to bring those together and offer an opportunity that doesn't exist across the state. And so we're proud of you, your team, and what you're doing for our community. We appreciate the service and look forward to that growing to many, many more. So thanks for joining us. I hope you've enjoyed this new format, and we look forward to more throughout the year. Happy New Year, and we will see you next month.